It's a big week for Ngāti Kahungunu and Ngāi Tahu paediatrician Te Aro Moxon. Dr Te Aro Moxon is graduating at Oxford University this week, where he was awarded a scholarship towards his Masters of Science in Global Health and Epidemiology, focusing on infectious and non-infectious diseases among worldwide populations. Paediatrician and senior lecturer at Auckland University, Dr Te Aro Moxon, is with us now. Tēnā koe, Dr Moxon. Thank you so much for joining us.
Tēnā koe, Neil. Ka nui te mihi. Lovely to be here.
And it's good to have you back in Aotearoa. I believe you're flying back to the UK tonight for your graduation ceremony this week. What are you looking forward to most about the lead up to graduation?
Oh, there's a few key things. It's quite a special time for me. When I was in the UK, I was studying during the pandemic, and so there were a lot of restrictions, there were a lot of challenges, and so I would have been due to graduate a little bit earlier, but I deferred the graduation time, and now that things have opened up a bit, it's an ideal opportunity to head overseas. It'll be quite special having the opportunity to be at my college for graduation and to complete the task that I set out to achieve a couple of years back. So it's something I'm very excited about.
And I can imagine, well earned, well deserved. We spoke prior to your departure, and I speak with your mama, Lady Tūreiti Moxon, regularly on the show. So I need to ask if your proud mama and papa, Sir David Moxon, will also be joining you in the UK for this special event.
Yes, indeed. I'm pretty fortunate they'll be able to come along with me and be my support crew. And it'll be particularly special for a number of reasons, just to be with them and to have them there at the graduation. But also, my father had graduated from Oxford University many years ago. And so the opportunity to be in Oxford with Dad and also with Mum, to visit Dad's old college and then to show him my college of Green Templeton, it'll be something quite special. And I'm looking forward to the many catch-ups and checking out the areas that Dad used to visit when he was a student there many years ago.
How wonderful. Now, you were also recognised for excellence in teaching and operationalising Māori health equity by Te Whatuora Health New Zealand Waikato last year with the Excellence in Clinical Equity Teaching Te Tohu Hiranga Award last year. So what's your vision of how equity can be utilised more fully?
Well, my vision for equity, I put it this way. Whenever I present about child health at different conferences or when I'm teaching, I show a number of graphs, and it demonstrates, significantly different health outcomes for tamariki Māori compared to children who are non-Māori, and also worse health outcomes for Pacific children as well compared to non-Māori, non-Pacific. And so for me, what I'd love to be able to do would be in the future to see those gaps continue to reduce. That would be a definite goal, and then to see those gaps disappear so that we don't have the major differences in health outcomes by ethnicity in Aotearoa, New Zealand. So I'd really love to see us. It's going to take a lot of work. It's going to take a lot of effort at multiple levels, but definitely want to play my part in terms of drawing attention to the inequities that we see and working towards improving those health outcomes. So that children who are born regardless of the ethnicity in Aotearoa can expect good health outcomes. And that's something that I want to keep working through in my career, in my lifetime.
And it's great to have people such as yourself who are educated in this field and want to do good for our people. Are you planning on spending more time back here in Aotearoa or back overseas?
When I applied for the Masters, I was very clear. I wanted some time overseas to try and get a bit of a global view, to understand health inequities at a global level. But my heart's in Aotearoa, and so I'll be here for my career for the most part. I'm really passionate about improving the health outcomes for our tamariki here in Aotearoa. So I'm in here for the long haul.
Beautiful. Now, how do you feel that your education at Oxford University has helped with your ambitions in this space?
Well, firstly, I think it's a real privilege that I had the opportunity to go and study at Oxford. It was something that was dear to my heart, and in applying, I was hopeful that I'd get in, and just very fortunate that I was able to get in, and then had the funding through the UK government with the Chevening Scholarship, and then to have that support to make it a reality. Basically, by having that by undertaking this course, it's helped me to build the foundation that I need for producing high-quality epidemiological research, to understanding the issues that we have here in Aotearoa in terms of health outcomes, and then looking at solutions. So for me, it's creating a good platform for the rest of my research career, and also having gone to a university that is internationally so well known, it opens a lot of doors, I think, and creates a lot of opportunities. So a lot of blessings, and I'm going to use it as a platform for my further research and future mahi.
Beautiful. So what will you graduate with, and when is this happening?
So I'll graduate with a Masters of Science in Global Health Science and Epidemiology, and I'll be graduating on Saturday, 4th of March. So we'll get to the UK with a few days up our sleeves, get everything ready, get the graduation gown, and then get in there and get the certificate.
Wonderful. Dr Te Aro Moxon, soon-to-be graduate of Oxford University, thank you so much for your time today. All the best for your graduation and safe travels. Ngā mihi.
Ka nui te mihi ki a koe, Neil. Ngā mihi.